The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. This is Dr. Tom Roselle. You're listening to Asia's Health with yours truly, and we've got an interesting program, as we always do. We're going to talk about our old friend, inflammatory reactions, but here's the deal. What comes first, the pain or the inflammation? Or does one trigger the other? And it's an ongoing conversation that somebody says, well, you can't have a pain pattern unless there's underlying inflammatory processes. And then there's others who say the reverse, right? So we're going to get into that a little bit today as we started the program on WMAL 105.9 FM just a few minutes ago. And we want you to understand the differences and more importantly, the ability to identify, if you will, the inflammatory pathways and can you see pain without inflammation? And that's kind of leading up to a topic that we're going to be doing on September the 17th at the Roselle Center in Fairfax, Virginia. And you're invited to attend. All you have to do to register is go to drtomroselle.com or rosellecare.com, as you see it right now in front of you on the screen. Or simply you can call the office at 703-698-7117, and we'll begin to prepare for you, if you will. So, because this is a really important diagnostic consideration. We're going to be talking about thermographic imaging and how can it detect? Does it just detect pain or does it detect inflammation? Does it detect both? Can it see below the surface? What diagnostic tools do you need to differentiate? But let's get into the topic today. Let's get into thermography a little bit. But we're going to talk about that pain, inflammatory reaction, which comes first. You know, you're hurting, you got shoulder pain, constant's always there. You go to the doc, said, I can't find anything. Or, you know, you have this ongoing process where your hands are swollen and they don't really hurt, but they're stiff. So what I want you to understand is that inflammatory reactions, inflammation, can cause a cascading effect of all kinds of things that you may not be aware of. And what I mean is this. Let's take this for an inference, right? If you have an autoimmune condition in the intestinal system, in your gut, and you've been ignoring it, now all of a sudden you have elbow pain, or all of a sudden you have knee pain, all of a sudden you have ankle pain, and you go to the doc and you said you have polyarthralgias. That's the multiple joint space pain. That's all it means. And they're going to give you this drug and that drug, and they're going to try this and going to try that. But have they identified the triggering mechanism or where it's come from? So let's get into that just a little bit. Let's talk about, you know, these pathways of irritation, if you will, and, you know, talk about what's the deal first. So let's talk about the subtle signs of inflammation, because those are really important, right? So recognizing subtle signs of inflammatory reactions is critical, if you will, for early intervention and prevention of much more serious conditions that may be underlying, even thyroid problems. So we know that there's things like Hashimoto's thyroiditis, right? That's when something called TPO on your blood test begins to go up. What it stands for is thyroid peroxidase antibodies. And you start seeing these subtle changes, but are there signs and changes beforehand? Well, on the 17th, we're going to talk about that. And you can actually begin to see the inflammatory response in the thyroid before you even have symptoms. And we just start seeing the subtle changes. How many times have you gone to your doctor and said, well, let's watch it. Let's see what happens. It's not that bad, you know, but you don't feel good. And is there another diagnostic mode that may identify this pattern? Because even with a thyroiditis, a TPO problem, a Hashimoto's problem, or just a thyroid antibody problem, ultimately you're going to have some pain. besides all kinds of other things. So let's get into it a little deeper. Let's talk about it. How about, we talk about persistent pain is one of the keynotes of inflammatory something something or persistent fatigue. And the pain doesn't have to be significant. It can be very low level and it's just a bothersome situation. You're getting tired of putting up with it. But how about if it's coupled with persistent feeling of tiredness? It's just like, not good, right? You're always beat up, you're always tired. And you wonder where that's coming from. You go to your doc, and the doc runs a blood test, and he says your iron level's fine, your B12 is fine. So why are you so fatigued? Why are you tired when it comes to something that is under the surface, i.e., inflammatory reactions, right? So that constant, persistent fatigue pattern can be finger pointing to an underlying inflammatory reaction. How about mild joint pain? We just talked about that. Stiffness in your hands, the joints. It could be anywhere in your body. Here's another one that we don't kind of relate to it. We have that pain pattern, but how about memory and cognition decline? Yeah, you can have it at any age, and maybe something happens. You were out playing, you bumped your head, something took place, you triggered an inflammatory reaction. Now, it can be a worsening condition slowly over a period of time, leading to, when you finally decide to do something about it, your doc says, well, it's, a old age, if you will, onset dementia. Well, maybe not. Why are you only 35 years old or 40 years old and you have old age dementia? I don't think so. It's a finger pointing to that there's an inflammatory something that's taking place. Digestive issues, bloating, gas, diarrhea, constipation, a lot of the things that we've talked about in an ongoing situation. You go to your doc and say, I'm bloated all the time. And they say, well, a lot of people do that. You're probably eating, the wrong things. Then they send you out and they do RAS tests. What a RAS test is when they put those 40 or so little antigens in your skin and they show up. The problem with a RAS test is it's 40% inaccurate, false positives, false negatives. Because when you put food in your mouth and you swallow it, the composition, the biochemistry changes when it goes inside. So some of these things may not be very reactive to you, but some of them might be overreactive to you, but you're not getting it with a RAS test. There's only a few tests that actually make a difference. If you go see somebody like me in the world of applied kinesiology, but true applied kinesiology, somebody who's certified, a PAC member, professional applied kinesiologist, we can do testing using substances that are like milk and dairy products and your favorite peanuts and so forth. And we test them over reactive points in the body using a huge magnet, a 10,000 Gauss magnet. I'll show you my cell phone. And it's probably about that big. South Pole pushes things in. And we use that to see if there's going to be a neurological response. What do I mean by that? That means that, and we do a muscle test specifically, and it has to be accurate. And then we expose a substance over the thymus, over the liver, over the intestinal tract, and then we retest the muscle. If in retesting the muscle becomes inhibited, in vernacular, weak, then we know that that substance is something that is causing a problem within the body. Now, we'll go on from there because that's a subject that we can get into, and we will at a later date. But signs of inflammation are what we just talked about: fatigue patterns and joint space stiffnesses and cognitive decline and digestive problems and ongoing pain that just doesn't seem to go away no matter what. And then you get stuck on everything. So let's make sure that we understand that there's a differentiation. And now what I want to tell you is this: we have the ability, and doctors that do what I do have the ability to identify inflammatory reactions at a subtle level before they even become problematic relative to what we're talking about. We're talking about pain patterns, right? So what do we use? Obviously we use blood work and so forth, but we want to be very specific. We don't want to go on a hunting expedition to find out, all kinds of things. You don't need it. Your wallet doesn't need it. You want to be specific. So what do we use? One of the diagnostics that we use is thermographic imaging, and it can detect low levels of chronic inflammation. And here's the beauty, as we've talked about, it's not invasive, there's no radiation, and it's a camera that was developed decades and decades ago to be able to identify inflammatory pathways. And thermography is amazing, extraordinarily effective in picking up inflammation. Ladies, those of you who've used thermographic imaging for detection and potential preventatively of breast cancer, you know that it's even, in my opinion, based on all the information that's gone forever and forever, can detect cancers better than mammography does. Now, here's the deal. I'm just going to do a sidebar on this. If you have had several mammographic imagings, radiation to your breast, crushing of the breast tissue with about 45 pounds of weight, you have increased your risk of breast cancer because of the radiation, because of the subtle damage. Look it up. Go to the British Medical Journal, go to PubMed, go to Townsend Letter, go to Nature Letter, and so forth, and read the stuff. Look, when they use these multi-million-dollar pieces of machinery tied to computer systems and so forth, they have to pay for them. But you have options, and I want you to learn about the options. And on the 17th, we're going to tell you the differences. And here's the deal. We're going to give you information that you can reference. You can look it up, but now you know. And guess what? You come away from that session on the 17th, you're going to know more than your doctors do. I promise you, it's going to be an interesting evening. But let's talk a little bit more. Let's get a little deeper on the differentiations between the subtleties, if you will, of pain and this inflammatory reaction that we're looking at. So inflammation can cause pain, and it's often a very common symptom that's associated with acute and chronic, long-standing problems with whatever happened to you, right? So you have to understand, if you will, the process, what takes place, and you have to be able to differentiate acute from chronic situations. Inflammation is your body's natural response to injury, infection, and any kind of abnormal stimulation to the body. And it's a whole complex process, really. And it activates your natural immunological reaction. During COVID, when it said, oh my God, interleukin 6 and this interleukin and that interleukin, that was your body's natural reaction to something that was happening in your body that was harmful to you immunologically, and your body was trying to protect you. The problem was that it continued to initiate, it continued to move forward. And particularly interleukin 6, which when it's there, and it can actually cause a destructive situation. But there's many interleukins, interleukin 1, interleukin 10, interleukin 4, and so forth. And they have different responses in the body. So this is not the program to do that, and I mean differentiate it, but I'm letting you know that there's a whole lot of understanding, if you will. So we're just touching the surface to tweak your interest. So you'll come and join us on the 17th, but I'm going to give you pieces of the puzzle. So when you have an acute inflammatory reaction of any kind, can it cause pain? You betcha. The pain arises because of the inflammation and the chemicals stimulating the nerve endings, the little end plates, right? And increases the sensitivity in the area that, whatever it was, you get a blow to the head, you get a blow to the hand, you crush your finger, you step on your toe, somebody hits you, and you have this immediate response. You go, ouch, it hurts. You have a withdrawal reflex. But what takes place is that now you look down and you say, oh, or you look at your face and it's red and you got this puffiness. And now you have this inflammatory response due to a chemical trigger that is now affecting the neurological system, and it reports to the brain that you have pain. So if that's the case, when does it stop? Well, you don't walk around in pain all the time. The body will drop it down a bit, but sometimes it doesn't go away. because the body has the ability to remember the pain pattern. Now, is the inflammation still there and the triggering mechanism goes away? Or does the triggering mechanism go away, but the pain is still there? So let's take the next step. Let's talk about chronic inflammation. So unlike the immediacy of an acute situation, chronic patterns are simply something that persists over a longer period of time due to what? Ongoing irritations or sometimes autoimmune conditions. So chronic inflammatory reactions can lead to continuous pain and discomfort. Now, you'd like to know if it was there or not, right? I have a patient that came in and said, every time that she overstretches her shoulder, and it doesn't seem to hurt before she does that, but overstretches her shoulder, then suddenly she's in pain for 2, 3, 4 days until it settles down. Is there an underlying inflammatory reaction there, or is there a neurological trigger that now reminds the body that there's injury there that's never been cleared up? We know now something very interesting, that the skin tissue underneath it, between, the top is the epidermis, right? Underneath it, the subtle pieces, there's this fine neurological network that's embedded in the fascia, if you will, of the skin surface. And because it's there during the injury, right? So it's always there, obviously, but it's there, and then something happens to it, the body protects itself. It'll go into a tightening reaction, or the fascia will clump up, and it kind of, reacts so you don't do it again. It limits its motion and so forth. But all of a sudden you overstretch it. All of a sudden you hit it. It's a trigger. Now, all of a sudden that pain pattern goes back. There's a memory bank in your computer, your mainframe, called your brain. And it hits the spinal cord first. Part of it goes into the brain, part of it reflexes back. And you end up with this chronic triggering mechanism that never seems to go away. Now, on thermographic imaging, there's always going to be a subtle inflammation on movement. There's going to be a subtle inflammation that may be persistent under one spot. But this trigger, if you will bring it up to the surface. You're not aware of it. Maybe you've adapted to it. But here's the deal. As long as it's there, now it's forming scar tissue. And we can say it's attacking healthy tissue. It's causing damage. It's causing pain. It's causing degenerative changes. It can happen any place within the system. And we're going to show you how you can identify it. But let me tell you this, it can be resolved. I was dealing with a college athlete the other day. And this is a big, big young man. He's in the neighborhood of about 6'3", weighing about 290 some pounds. And he had hurt his ankle. And he had first preseason game, and he twists his ankle, and you can see it like this. Well, we compressed it. We did a lot of stuff on it in the initial phase, get it done. The next day, I went in and I challenged, meaning I tested a muscle that worked well, and I spread, twisted, pushed into that skin tissue where the injury was, and it weakened the muscle that was not associated with it. So then I found a direction of the skin challenge that dropped not only the muscle reaction that I initially found, but all of a sudden I held it in that position. It was allowed the pain pattern, the cycle, to drop, and all of a sudden the swelling, the inflammation dropped exponentially. That's a whole different thing. We call that myofascial gellosis patterns. And get me quietly and I'll tell you all about that. But there's ways of identifying and fixing something that may have been there for years and years and years and years and years. So we want to identify what comes first. Is it the pain, or is it the inflammation? And is it something that can go away? And does it take forever to make it happen? Not necessarily. So let's get into this just a little bit more, because I want to kind of trigger your thought process and what you can do about it. I'm going to go back to that myofascial pattern. Let's say that you have an arm that just doesn't want to go up. Take your fingers and push it this way. and just hold it. You're on the skin surface, not on the muscle, but you're going to really push into the skin surface. See then if you can raise it more. If you go the other way and it can raise more, then that's the direction. So all you're going to do is you're going to kind of hold it in position and stretch it just a little bit on the skin surface. You're going to hold it for maybe a minute and see if it makes a difference. What it's doing is breaking up the fascial scarring in that primary level. And because of that, now the tissue can work. And because of that, it can get rid of the inflammatory reaction, increase the blood flow into that area. So now that scarring, if you continue doing it, will go away. Now, it has to get deeper sometimes. You got to get into the muscle tissue because, if you look at my fingers, these are muscle fibrils, right? And they're wrapped up in fascial patterns and so forth. Even down at that level, that fascial change can get tight. Then the muscle starts pulling abnormally, and it can cause other joint spaces and so forth not to function properly. Now you're set up for more injury. Now we have a lot of things to take care of, and we got to dig deeper. But so what's first, the pain or the inflammation? Well, we talked about a little bit about that on the radio just a little while ago. But here's the deal: inflammation causes pain. Pain will cause inflammation. What do I mean by that? You just got hurt. You hit your head. You bumped into something. You did something that caused right now pain pattern. That right now pain pattern triggers the inflammatory reaction. But you can have underlying inflammatory reactions due to diet. It's going to affect your stomach and then the muscles that are associated with the intestinal tract and so forth. So that inflammatory reaction now, because of aberration, abnormal function in the muscles that are attached to other joints, now you got pain. So it can go either way. But now you want to stop the trigger, the round robin effect that continues to cause that to show up over and over and over again. But you have to understand where it may be coming from. You can have hand pain, but it's coming from your neck. And you've learned to put up with, not being able to turn your neck fully. And so when you're not irritating that, or you're not in a certain position in bed, you don't wake up with your hand really in pain, or you have to move all night long to change it, because it's not your arm. It's coming from someplace else. Thermographic imaging is extremely effective in identifying exactly what the pathway is and where it's coming from. Now, you may have to fix multiple things along the pathway, but now you can see it. You can see the process. Here's something that I'll tell a patient to do. They say, my hand hurts. I don't have the ability to grab. I said, okay, so here's what we're going to do. I want you to turn your head away from the side that hurts you and kind of look down, just gently stretching it down. And then I want you to try to open and close your hand and see if it's more flexible. If it is, it's telling you that one or several of the vertebrae, the bones in your neck, there's 7 of them, may be out of position millimetrically, just a little bit, causing irritation to the nerves that go into the arm, into the hand, into the fingers, because something happened a while back. Postural pattern. How many of us today, we sit there with our cell phones like this, right? And we always have our nose in our cell phones. And we don't think that there's a postural distortion because we rarely do it like this. We do it like this, our heads down. Not okay, is it? Think about it. Think about the postural aberration. I'm sitting in a chair right now. What happens if I slouch down like this? What happens if I'm not sitting up straight? If I want to sit way up straight, I'm going to do something like this. Now my posture pattern is a lot better. But we all get into bad habits, and it can cause a problem. But those bad habits can cause inflammatory reactions because of overstretch, compression, and irritation. Even when we're in the gym, we go in the gym and we try to work out. And because we think we're heroes, we're going to do more than what we should. And we come out, we're stiff and we're sore and we're tight. I'm going to give you another one. If you go work out, I don't care if it's Pilates, if it's yoga, or if you're going to go do some machine type of weights, you want to go easy and so forth, you don't do too much. But if you come out of that workout feeling tired, you come out of that workout feeling depleted, that workout was too much for you. Your body's trying to tell you something. You should end up after a workout, particularly within a few minutes after a glass of water, feeling really good. Your body should have that sense of energy. You should have a sense of strength that you didn't have before you did it. Now, there's times to overdo it, but you better be in really good shape to make it happen. Because if you're not, you're going to get hurt and you're going to cause inflammatory actions that then can cause pain. Or the pain pattern that you did by contracting the muscles, by overstretching, by pulling too tightly, by putting vertebrae bones out of position, we call them subluxations, now trigger the opposite response. So what comes first, the pain or the inflammation? Either. It can be one or the other. It doesn't mean that inflammation is the only trigger mechanism for pain. There can be a localized response, ouch, and it pulls away. But the next step is an inflammatory response. Or there can be an inflammatory response that now subtly, slowly, and now you have pain that you don't know where it came from. It can be autoimmune reaction. It can be other things. But thermographic imaging is a tool that we use extensively to be able to zero in and find the problem and where it's coming from. Somebody has neuropathies, okay? Numbness in your feet or your hands and so forth. Well, that neuropathic problem may be distally causing changes in sensation, but it may be coming further up from the feet. It can be, the feet may look cold on thermographic imaging. So if inflammation doesn't cause coldness, inflammation causes heat. So now you're going up, instead of looking at the feet and the calves, you're going to look at the hips and the back. And all of a sudden you see the hips and the back are on fire. On thermographic imaging, it's going to look red. Wouldn't you like to know that treatment is being directed properly and somebody actually gets it, they understand it, and there's ways of looking at the whole process? We're going to show you that on the 17th. Join Dareth Painter and I. Dareth is the primary principal of Thermography Centers of Fairfax and Thermography Centers of Virginia. She's amazing at what she does. And we're going to put it together for you so you really get it, so you really understand it. So make sure that if you have any discomfort, if you have any kind of ongoing inflammatory reaction that you've had, this is an opportunity, one, to see something that will really make a difference. Next week, we're going to have Dareth with me on live stream, and we're going to talk a little bit about breast thermography. And because coming up October is Breast Health Month, and I really want her to get into it, and she's going to talk about that as well in September on the 17th at the Roselle Center for Healing at 6 p.m. And I want you to register right now so you'll have a space. And we can't say, we've got too many people in the room. So join us, right? All you got to do is go to drtomroselle.com or rosellecare.com. I'm here every week with a little different twist on the subject, looking at different processes that affect your body, simply because you need to have the data. But more importantly, I love you all. Have a great day. Talk to you later. Bye.
Thank you.